The state agency that administers the Medicaid program in Oklahoma is facing a huge budget hole. When federal and state budget cuts, along with increased costs, are added together, the Oklahoma Health Care Authority needs $191 million to meet the health care requirements of its clients. State legislators have differing views on how to address that shortfall.
The governor's proposed budget cuts more than $47 million from the Oklahoma Health Care Authority. Preston Dorflinger, the head of the Office of Management and Enterprise Services, says it's fiscally responsible.
It is time that we put our foot down on these never-ending Medicaid cost increases. Taxpayers can't keep throwing money at it without getting improved results. It is unsustainable and it is not responsible.
Nico Gomez is the CEO of the Health Care Authority. He isn't counting the governor's budget cuts in his budget just yet, because that could change. But he says there is little doubt the agency will need more money to meet the ever-rising numbers of Oklahomans who get their health care through Medicaid.
But at the end of the day, we're going to need some additional appropriations above what our initial funding is. And we'll continue to reduce our program as much as we can to try to make those numbers meet in the middle.
Those numbers are a combination of how much the agency can save and how much the legislature's changes may further cut costs. Over the last 6 months, the Health Care Authority has saved some major money.
We've actually saved about $36 million. And now in percentage, it's about 3% savings that we've been able to achieve just in this first 6 months.
But how much of that money is left over at the end of the current fiscal year depends on whether health care needs increase or decrease by those who get their health care through Medicaid.
We continue to see more people coming into the program, and we continue to see more people utilizing services appropriately. And so we have to be able to pay for it. It's an entitlement program, so we're required, if we're going to have a program, we're going to have to be able to provide those services to the people who qualify.
One proposal to make major changes to the Health Care Authority has already cleared the House Public Health Committee. House Bill 2788 by Representative Mark McCullough would return the Medicaid program to managed care.
Bid out the entirety of our Medicaid population into managed care. This is a bill that is modeled specifically after Florida's law that was changed recently, a few years ago. It also follows the precedent of Louisiana and most recently Kansas.
That same bill passed the House last year but was not acted upon in the Senate. One reason for that is managed care is not a new approach for the Medicaid system.
It was tried earlier. It failed miserably. What Medicaid managed care does is take part of the very limited Medicaid dollars, give it to a manager to manage, and therefore removes more dollars from medical care.
Dr. Robert McCaffrey is president of the Oklahoma State Medical Association. The main concern of doctors is any change that would further limit access to health care for Medicaid patients.
We want to see Oklahomans who need health care, but we can't be expected to pay to continue to see those patients.
House Bill 2384 by Representative Doug Cox also won approval from the House panel. It would make changes that would impact doctors, pharmaceutical companies, durable medical supply companies, and hospitals to try and produce a savings of $45 million.
There's no way that I can sugarcoat this. There's going to be pain this year in the Medicaid system because less money, more patients.
But all of those proposed changes would require approval from the federal government, which takes time and may not be successful. Dr. McCaffrey also says cutting provider rates will impact some doctors and hospitals to the point of financial collapse, most likely in rural Oklahoma.
For some, it's going to force them just to quit, because you can only lose money for so long before you simply have to say, I just can't do this any further. That's obviously the last option.
Senator A.J. Griffin is a member of the Health Policy Committee and the Appropriations Subcommittee for Health. She will come into contact with any reform legislation that goes through the Senate.
So we do have several different things that we'll take up as a legislature this year to primarily look at not only cost containment, but more importantly, look at our health outcomes. What are we paying for? Are we paying for better health? Are we simply paying for unnecessary emergency room visits?
Senator Griffin wants to take a more holistic approach to reforms in health care.
We've got a lot of work to do to look at the system as a whole. And Medicaid funding and the increase in that spending is only a piece of that entire healthcare system.
Representative Jeannie McDaniel is a member of the House Health Committee. She agrees that the state must find creative ways to address health care issues.
We got to look forward to where we want to be. And we're going to have to do a lot of looking in the next 9 months, in my opinion, or Oklahomans are going to lose. It's not the governor, it's not elected officials, it's the people who don't have health care coverage and the hospitals who serve all of us.
But it was a question from Representative Jeannie McDaniel during the Health Committee meeting that added understanding to the state's ongoing struggles to meet the health care needs of people on Medicaid and pay its share of the cost.
If we would have accepted Medicaid expansion, would we be doing this?
We may still have a budget shortfall, but we would have probably more money if we had accepted the expansion.
For the Medical Association's Dr. Robert McCaffrey, there is some irony in the current state discussions over how to deal with Medicaid costs in state government.
We hear so much discussion that is against Obamacare, if you will. And basically the state government is saying, we're going to do the same thing.
And if the state reduces the state cost of Medicaid, Dr. Cox explains the places to do that are very limited.
So we're left with two things. We can cut services to the patients, or we can cut provider rates.
The proposals currently on the table at the legislature, if passed and signed into law, would still not be able to impact the budget of the Health Care Authority in time to pay for all the medical services it will be required to provide for at least the foreseeable future.